Hi, Dr. 𝗚𝗀𝗃 here again with Gonstead Physical Medicine. I'm going to be talking today about one of the sets of muscles with regard to the TMJ, the temporomandibular joint. So we're going to be talking about the pterygoid muscles. As you can see on this, we have two sets of pterygoid muscles. One is up here, it's the lateral pterygoids, and down here, the medial pterygoids. We're going to be doing something that you can do at home to help release your pterygoid muscles if you have TMD. There are other exercises for your TMJ, for the other muscles, and for your neck. But there are a ton of exercises online, so I'm not going to repeat them. I'm going to do this one because it's not found very much online. We're going to be releasing those muscles in our mouth. So as I talked about on the other videos, your sphenoid bone is where the lateral and medial pterygoids attach. So that's the red bone in here that looks like a butterfly. And the pterygoids attach on there, and they help you with the side-to-side motion of your jaw and front and back and up and down motion. So there are a couple things that we need to make sure that we do before we go putting our fingers in our mouth. I am going to be using a glove, or you can use a finger cot, or you can just wash your hands, which is easy as. But for this video, I'm going to use my hands. So I'm taking a finger, I'm going to be putting it onto my front teeth, then I'm going to go all the way back to the top molars. I'm going to go past the top molars and onto the top jawbone, which is up around here. And it's a big muscle, so you really can't miss. So you're going to be putting your finger up there and pushing in for about 3 to 5 seconds. And it might feel a little tender, you might get a tear in your eye, but that's releasing and it's going to help the TMJ. Then you're going to go on the other side, finger on your teeth. You're going to go to the molars, back behind the molars, onto the bone, and push up for 3 to 5 seconds. Okay, so it's going to look like this. And then we're doing the other side. All right, now we're going to go to the medial pterygoids. So that's on the bottom. So we're going to be down around here, and as I said, it's a large muscle, so you can't really miss it. We're going to start with your finger on your bottom teeth. You're going to track it all the way to your back molars and go past that, and then you're going to be pushing downward on your mandible, and then you're going to do that on the other side. You're going to be putting your finger on your teeth, tracking all the way back to your molars, go past that, push down on your mandible. Looks like this. And then the other side. And that will help to release the muscles of the pterygoids. You can do that several times a day, and that should give you some immediately relief, even though it might hurt at the time. I'm Dr. 𝗚𝗀𝗃. Thanks for joining us. Stay tuned for our next video, where we'll be talking about Gonstead Physical Medicine and what you can do professionally to help your TMD.